Okay, so we'll start out with fertility.
I think that's still 10A.
Hey, how about that? Okay, now, we start out with the basic premise that children are not a possession of the mother and father, so nobody has a right to children. Okay, that's what we'll start out in the beginning of that. Because you can imagine that even if you start to say, this is what I'm looking for in a particular child, of course you want them healthy, of course you want them to go to Harvard, of course you want them to be able to run a 4-minute mile. You know, we are now making the children a product of what we want. So the desire for children, we're saying, is based on our natural inclination to procreate. And as long as you are a Christian that understands that children have souls, and we understand that we're not the origin of the child's soul, then we have to admit that this is simply, we're not the sole origins of this child. Okay? So in dignitatis personae, that specifically human values of sexuality require the procreation of a human person be brought about as the fruit of the conjugal act, specific to the love between the spouses. Now, usually people, in other words, a child has the right to be born in the love of the mother and the father. It's that simple. Now, people are going to say, but that's not always the case. Okay, but when is it the case? Well, what if a person's raped? Okay, that's a violent act. I mean, we're not even talking about that, right? We're talking about a child has the right. We can't turn it back. But the reality is that this is the fact that, like, even like when single, like those of you that are at least my age will remember the scandal with the vice president and Murphy, was it Murphy Brown?
No, what was her name?
Oh, Candace Bergen.
Candace Bergen, right. It was,
Yeah.
what was her show?
The show meant about Murphy Brown. That she was idolizing single parenthood. And, you know, and they were saying, well, this is a woman's right and everything. But she wasn't obviously, you know, the standard for what was in the world. Most people who are single parents, this is not easy, and it's a struggle, and they would not choose it that way. So even though he got beat up for it, he had a valid point. So, you know, isn't it better then, don't they at least bring the child into the world, even though they may not have a father? Well, okay, it's not your right. Even though you're not saying it like that, and your intentions are very pure and good, you're still acting in a way that you have a right to this child somehow. You know, and if you say, well, but it's in my heart that I want this child in the world, well, you could help another couple bring this child into the world. It's not have to be yours.
But, you know, like if someone were to take your child away from you, like the state, you know, like, I mean, when you say the right to a child.
Oh.
You know, and.
Oh, you mean like if a single woman had a child, would the state come in and take it?
Yeah.
Yeah, no, that, you know, unless there's circumstances where they can't be provided for, they're being abused, no.
But I guess
You know.
the term right to a child, a lot of people would interpret.
I get you.
Yeah.
We'd have to almost back up and think of that one class we had here when we were talking about Marianne Glendon, that you knew sister, and she put everything in terms of rights talk. So everything, once you put everything in terms of rights, then anything that you are denied seems like it's being imbued on your rights. So if you're not letting me have a child because I'm a single mother, why can't I adopt this child? I mean, we could talk about this, like even with homosexual adoptions, how this would be discussed. But nonetheless. So treatments of fertility, artificial insemination, when the husband or another donor, the sperm is collected. It's typically collected through masturbation, and then via syringe or a catheter placed in the cervix of the vagina when the woman's ovulating. And she probably has taken hormones so that she can hyperovulate, so it increases chances. Or you can put it directly into the fallopian tube or uterus. You know, this we would say is an illicit form of treatment. Okay, we're totally circumventing. If we were to say what's the intentions of these people, well, they want to have children. That's a good intention. All right. There's a lot of, especially with IVF, there's a lot of issues that spring off of that. One, the frozen embryos is a product of, you know, the IVF industry. And I think when was the first IVF? Like 79, right around that time period somewhere. So our moral concern here is multiples. How is the sperm collected? You know, and if this were a full course on bioethics, there's perforated condoms. Sometimes, just my opinion, they can start to split hairs, you know, but we'll leave that alone. They're still circumventing the conjugal act. Use of the donor introduces another immoral element. What claims does this person have on this child, illegally or such? You know that you're going to be talking genetic selection. You didn't go down, you know, to a local diner and say, hey, you know, you're looking for particular things. And look for the articles that I put up for the dialectic. The one will be like in China, like what criteria, you know, do they use? And two, if you were a sperm donor and you donated to a sperm bank, they want, you know, there's criteria they want from you. And people are going to look at that criteria as they choose, you know. So it raises the question of the child being perceived as a product and then a right of the parents. So there's other issues, but there's a few.
Excuse me.
Yeah.
I know that when I was in college, some of my friends wanted to donate sperm to get money. But then they couldn't because they were deaf. So there you have it.
I would believe that.
Yeah.
Okay, why do I have this again here? Didn't we do IVF on the last page? Oh, that was artificial insemination. I think I was conflating this two in my head, I'm sorry. So here we have a hormonal simulation of the woman's body to produce multiple ova, typically 3 to 8, and then they surgically retrieve those ova. And then they join them in again in the Petri dish with ideally the husband's sperm for conception to occur. And they leave them there until it hits the blastocyst stage. And then they will deposit, usually it's multiple. So if we have a higher occurrence of multiple births, this is where it's coming from IVF treatments. Not always, of course, but it's higher in frequency. Octomom. What was everybody's big complaint with Octomom? Do you remember?
The doc, whatever the doc,
Yeah, who's going to take care of these kids? You know, all legitimate concerns. But do you know, in her defense, when she was asked why did you, because she had 8 ovum that were fertilized, why did you have them all implanted? She goes, because I consider them all to be my children, and I didn't want to lose any. You know, to her, in her defense, you know, she was at least thinking at that end on how we'd be thinking, because she didn't want to select which ones will I take. And what typically will happen then is if more than one does take, they could do what they'll, again, euphemisms, selective abortions. So they'll go in and if there's triplets or it's 4, we'll take 2 or 3 out and allow just the one in there. Any spare, so-called spare, are cryogenically frozen for future implantation, research and such. So again, I think we already mentioned, it's the same elements. You know, genetic selection, we're worried about, you know, this donor raises questions. What do you do if one of the parents dies and you have these, you know, frozen embryos? What happens in a divorce case? Whose are they? They do become property. I mean, these aren't fantasy issues that are, this is what's happening in the courts. The added evils of selective reductions. And you'll see, we'll talk a little bit about embryo adoption, but according to the National Catholic Bioethics Center, we're in an impossible state. There's nowhere out of this. So they will be there indefinitely. I'll give you a little bit of parameter around that. This is, and I just want you to just be aware of them. This is, you know, the gamete fallopian transfers, where they will separate the sperm and they'll place these in a catheter tube with air in between them, and then they will inject those into the fallopian tube if there's a blockage or something. And then they'll allow fertilization and conception to take place in a normal location. You're still circumventing the conjugal act. Okay, so not all types of infertility can be overcome, nor are they all preventable. Okay, what we never say, because we do not believe it, is, well, it's just God's will that you don't have children. No, this is an evil in our world. Not having children is a terrible thing. It may be the reality, it may be a very sad reality. But no, we're not going to put it, sorry, this is God's will. I'm never going to phrase something like that. I couldn't imagine hearing that. If anybody knows people who have had fertility issues, this is huge. I know a couple that they got married at 23 and they could not conceive. His wife got pregnant at 39, naturally. What a gift. Now, there's a lot of illicit fertility treatments that could be brought to bear. Could we do anything about this blockage? Hormones, anything to correct the dysfunctions? Can we assist the conjugal act? Is something that could be done within this conjugal act without circumventing it? So anything that can be facilitated. And there are some things here that just simply are not set in stone. Like, can you transfer, like if there is a blockage, can you go in and surgically take this embryo person and just move them around the blockage? I mean, people will argue about a lot of things. Of course, we know natural family planning, and if you did go for IVF treatment, this is probably where they would start. Let's look at the signs of fertility, and let's see that if we can't work with the method that is already natural to the human person. So anyway, there's issues around this. It's not always, though, not always. So let's talk about these frozen embryos. This is a really ongoing debate, and I'll be forthright. In very, very strict circumstances, I see it to be permitted. I wrote and had a paper published on it. I can tell you Father Tad would not agree with me on that particular. I can tell you that William May, who's another famous ethicist, fully agrees. In fact, I think he goes too far, all right? And I'm not putting myself in that league. I'm just telling you, this is where I'm at. Okay, there's an ongoing debate among reputable theologians. It's still an open question. At least some people think it is. A recent Vatican document, Dignitatis Personae, it expressed serious moral reservations about the approach, but it never condemned it as being immoral. Father Tad hopes in the future that there's artificial wombs that can bring these children. To me, I still say a child has a right, and I'm not trying to compete with his brain, but a child has a right to be born of the love of the mother and father. So under I don't think people like single people can go and adopt embryos. I don't mean that. But if you're a husband and wife and you have them frozen, William May's point is that you've already circumvented the act. We can't undo that. If you're the mother, would you take them back? I made the argument. It's called HET, heterologous embryo transfer. It depends. William May goes a little farther with it, like I said. So if you're against the use of the embryo adoption, you're going to say maybe there'll be some sophisticated incubator in the future. Or perhaps we don't know, will they die? I know freezer burn is a terrible term, but that's the one he used. Will we get to a point where we realize they're no longer viable, so they have died naturally, so it's no longer an ethical issue? Will they get past the point where now, even if they could be thawed, can they still be used? In other words, you can't just stop the life. You can't just turn off the freon.
So this is a frozen embryo between two people.
Yeah. So when if they extract the ova from the woman and the sperm from the male, they'll fertilize these in a petri dish. And let's say they have 8, they might implant 3 into the woman. Well, they have 5. Well, if one of those they have 5. What we do with these, they're going to cryogenically freeze them.
So it's
Now what do we do? This is where we're at.
And now what you're saying is you can take those back and continue.
I'm just saying, and that's not just me, but I am telling you that the National Catholic Bioethics Center would not agree that if it's the wife, could she take them back? And I made an argument in a published paper. People could disagree. I'm not saying, like I have friends who are sisters, nuns, say, well, why can't we adopt them? For the same reason why you wouldn't be allowed to adopt, a 2-month-old. A convent's not the place to raise a child. I mean, the mother and father is. So I'm not saying we should just open it up. Now, another concern is if that was determined moral, they're afraid, well, that opened the floodgates. Now, will that no longer be an obstacle? People won't care about it because they know somebody will adopt those. That might be true, but I don't think that would be bearing in the morality of it. That's just my opinion. So if you're for it, May and Grice, you've read one of these, they argue that, and this is where, remember what I said when we determine what the object of the act is? Sometimes people they claim that it's a trick on the use of words. So how are we declaring this? Are we declaring this as a rescue, which would be permissible, or are we declaring the object as circumventing the act, the conjugal act? It's how you would call it, and I'm not making a light. May says, and he was the ethicist at Mount St. Mary's, I don't know, for 30 years. He says there's no cooperation, formal or material. He said, in other words, it's done. IVF is an evil act. He agrees it's done. What do we do now? Okay? And this is, I'm just showing you this because I think it's a weak argument. But this is where he'll make it off of. In Donum Vitae, this is the actual text. Those embryos, which are not transferred into the body of the mother, are called spare and exposed to an absurd fate. No safe means of survival can be illicitly pursued. That's where it's left. That's why we don't know what to do. It says no safe survival can be illicitly pursued. Well, what options do we have? He says, and this is where I don't think it's logical or very sound. He said, it says here, the ones which are not transferred into the body. And he said, why did the church condemn that? Because the church didn't condemn that, that's not an intrinsic evil, so we could do it. I floated it by Father Tad. He whacked that down pretty quickly, and I think rightly so. I don't think that's strong enough. I don't. I don't know, how are we circumventing the conjugal act when it's done? We already have a human person. This is my thing. And the person, one professor I had here, he agreed too. But there's no consensus on this. So this is a rough area. It's a shame we're in
I
it.
have a question.
Sure.
Also, I was thinking that if they were to go ahead and implant them, there's no guarantee that they would survive anyway, right?
Correct.
So for me, that would also create an awkward situation someday down the line. Let's say a woman decided she wanted to give birth to her brother or sister, do you know what I mean? Like something that could get sticky someday.
Yes, well, the argument I made would only allow a return to the donating mother, the donor mother.
That's your argument, anything that could happen.
Yeah, anything still could happen, but at that point, it's not willed.
Yeah.
That would be the only difference. Their intention was to bring the child to term, but it did not occur. So that, to me, would be the equivalent of a spontaneous abortion, a miscarriage.
But if it lasts for 15 years, you could have that scenario where.
You could.
It's kind of bizarre.
And I have so much research on this. There are situations where they have been held and they were brought in when the child was like 13 or 14 because the child needed a bone marrow transplant and this would secure it. Okay, well that's a very utilitarian way to be brought into the world. I think there's even a movie made about that. There's also, I think Law and Order did a whole series on this. The wife, they were separated. The husband received the frozen eggs in the settlement, and then he remarried somebody younger. Could he have that woman bring this? I mean, no. I mean, I would not say absolutely not. When I made the argument, I was trying to say, in a time, there had to be a time factor in it. The mother herself, regretting her situation, could say, I'll take these back because I think that her womb is the natural home. That's just my opinion, though. I'm not saying anything more. Okay. It's just a shame we're in that situation. It's brave new world. I mean, it is brave new world. You probably know most of this about procured abortion. 2,700 children murdered every day. and we're calling it murder. I mean, we'll make this argument from natural law. I'll show you the argument to make. That's 112 every hour. So AGI is the Alan Guttmacher Institute. Alan Guttmacher was a president of Planned Parenthood. So if we're using his statistics, this is not some Catholic shady statistics site. These are his statistics. Why do women have abortions? 74% of women who say they're having abortions, it interferes with responsibilities and lifestyle. That's not the Catholic Church saying that. We're just saying, huh? You know, let's stop pretending that, you know, it all has to do with an underage rape victim who has no money. I mean, you know, we always put that may be a situation, but 73% can't afford to have a child. Well, I don't know what that means. I can't afford my kids. And I'm not making light of that. You know, who can afford a kid? 48% don't want to be a single parent, or they have relationship issues with the father. That's unfortunate. But, you know, principle of double effect is already, you know, we're an intrinsic evil. Less than 2% because of rape. And remember, incest has nothing to do with this. Nothing. If somebody says, what about rape and incest? Okay, I'll talk to you about rape. Please tell me what incest has to do with this. And all they could be talking about is underage people who were, you know, in a family that were raped. Okay, so it's rape. Because incest doesn't include a 24-year-old sister and a 28-year-old brother. That's not your issue, right? So, okay. So less than 2% the result of rape. And of course, we say, as tragic as that is, we're not going to create one evil. We won't do evil that good may come of it. Theological foundations, I didn't even bother trying to give you a bit more than a sampling. You can't argue this from Scripture. I mean, you can, but the Christian denominations that are okay with this, they know those verses. It's not going to be an effective way to argue it. Which is what the whole last class is about. Like, how do we make the cases on certain things? I bring this up because I want you to be very clear on something. I don't know if you've ever heard from people in your family. I have. You know the church changed its position on abortion. You know it. It used to be when they felt the child move, after that you couldn't have an abortion. And before that it was allowed. You know it. You're a theologian. You know the history of it. No, it's not true. Okay. An abortion was always the ending of a human life. What they didn't know was, when does the soul enter the body? You know, in other words, we had no idea on how fertilization occurred until the 1800s, how these haploid cells, you know, are formed. So what they thought was what everybody else would have thought naturally. It's the quickening. It's when you felt movement. That's when the child became animated. Anima is the Latin word for soul. So that's when the soul entered. So at that point we had a human person, and it was now an abortion. The criteria they were using wasn't when it was happening. That's the best they knew. We have learned through science that it happens at fertilization. So the church never changed its position on abortion. They were steady on that. What changed was their understanding of when life began. Different story.
Those embryos that we just talked about, do they have soul?
Yes. Yes. We'd have to say yes. So anyway, there's some things from the church fathers. There's plenty there. And, you know, even in, they used to call it, we call it infanticide, they called it, I'll just say, you know, letting them open to the elements. They would let the young children, you know, exposed until they died. That was a practice we'd call infanticide in, you know, ancient Rome and such. So anyway, the church never changed its position on abortion. It's impossible to make that case. What they changed was understanding from the quickening to conception. So the timing. So the abortion was always the taking of an unborn person, a human life. We just didn't know when life began, and now we do. I'm not going to read through these, but But you know anybody who formally cooperates? That includes the doctor, that includes the woman. Now, there's extenuating circumstances, right? But if they are formally cooperating, they concur in the intent, no one needs to say you've been excommunicated. You have been. Okay? It's automatic. Now, this isn't about a young, I mean, I'm sure you know stories I do where young girls got pregnant and their parents were forcing them. I met a girl in college like that. You know, it's funny how God puts you together with people. One day she's crying. And I said, what's wrong? And she goes, I had an abortion. I never told anybody. She goes, I don't know why I can tell you now. I said, well, I don't know why you can tell me either. I mean, it's not like I could do anything about it, but her mother forced her. Okay, well, that's not this. She's not Catholic either, but.
Are there other excommunications other than abortion?
I'm positive they are, and right now I can't think of one. Does anybody know? Automatic. That it doesn't need to be formally declared. Just by the fact that you've done it. Lete sentente.
When you remarry and you have, if you get a divorce and then you remarry without getting an annulment, is that?
I guess that would be one also.
I don't think it's excommunication. I think that's-
Yeah, that might, you're just not eligible for the sacraments. Now, what Pope Francis did here, if you heard about any of the confusion, was, you know, even though, like my diocese was always allowed, the priests were allowed to forgive this. Some dioceses retained that right to the bishop. Francis. In other words, if a girl had an abortion and was excommunicated, it used to be in some dioceses that she had to have the permission of the bishop. And Francis said, no, every priest is allowed to do that. That's part of the pastoral rights. And some dioceses were already doing it. In my diocese, nothing changed. It was that way since the 60s. And that's a great thing, too. Okay, whether you know about any of this or not, just so you know something about the actual events, obviously Norma McCorvey, who, if you went to pro-life marches in the last decade or so, she was there. She was the row, and she knew nothing about it. It was lawyers that did this on her behalf. So most of the claims that they were saying, you know, about her had not occurred. So Roe v. Wade said in the first trimester, the stage prior to approximately the end of the first trimester, the abortion decision and its effectuation must be left to the medical judgment of the pregnant woman's attending physicians. It's their call. In the second trimester, let's see, they talked about promoting the health of the mother. They can regulate the abortion procedure in ways that are reasonably related to her maternal health. And then in the third trimester, subsequent to viability, which was 23 weeks back in 1973, and this is really a bad precedent, but that's how laws are. The problem with viability is what happens if this viability goes down to 2 weeks? What if we do have decanters? Then the whole law is just going to go away. So it might be its own undoing. I think, where are we now? Are we at 20 weeks or 21? Okay. Anyway, abortion, except when necessary, is appropriate in medical judgment for the preservation of the life or health of the mother. Now, there was a sister law that went into effect at the same time, same day, Doe v. Bolton. And Doe I think she just passed away. She was another person that had nothing to do with this, but nonetheless, her case was brought up. So, you know how this goes in a conversation. Well, Catholics, they don't care if the woman dies. All they want to do is save the baby. They won't even allow abortions in the case of life of the mother. Okay, well, you know something already about double effect and what can happen. You know, if a woman is dying of uterine cancer, they're going to try to save her. And if the child dies in the meantime, oh, so you're for abortion. No, because you guys know how to turn a moral object. I mean, you know how to say that stuff. It's not going to win the argument. I mean, it might win the valid, make it a valid argument, and you'll win the point. Not that they won't concede. But the life of the mother is really not an issue. It does happen, but it's not like what they're talking about, right? Most times, the people in the situation will do their best to save both, fully realizing that perhaps one will die in the process, okay? So Doe was Sandra Cano. She had no idea the case was filed on her behalf. And Bolton was the Attorney General of Georgia. So life of the mother sounds like, well, she's on her last leg, but it's
How
not
can
that.
a case be filed and she is not aware of it? How does that work?
They filed on her behalf for the common good of what they'll say of the community. I don't know the legal,
Yeah, I was wondering how that works.
They wouldn't have brought the woman in.
no. That's true, she doesn't have to even show, maybe they could just say they're doing it on her behalf, and they have her name and everything else, and she doesn't know it, that this is going on, and the case goes up not as Cano versus Bolton, but Doe v. Bolton, so she'll never know. She found out later it was her.
So, how's that legal?
I don't know, I'm not a
It
lawyer.
doesn't sound legal to me.
It doesn't sound legal.
But anyway, if they determine abortion is necessary, the professional judgment of the physician, right? They're going to say, here's what life of the mother means. So if somebody says, I believe, like I'm against abortion except in the case of the life of the mother. Okay, I'm very glad to hear that. Because if you can vote for that person, and if you're a politician, you can even say that. Because you're lessening what's happening. And you can make a viable moral judgment. Look, if I vote for this, you voted for abortion. Yes, but I only voted for it in the case of the life of the mother. Well, that's even wrong. Yes, but right now it could be for anything. So I'm just lessening it. That's legal. I'm moral. Okay? But life of the mother is the physical, emotional, psychological, familial, and woman's age relevant to her well-being. That's what, it's not she's going to die. Is this going to be an emotional scar on her? Does she have other children to take care of? That's the legal precedent that was set here. Okay, this all went through the same way. All right? So those are the court backings on it. You can mention those, but again, I don't think that's going to do it. After this slide, I'm going to show you where I don't know what and I can tell you, this is the only thing I've had people come to me and say, I've changed my mind after hearing this. Because I don't know what the argument against it is, right? So we start to ask questions, right? You'll hear people say, well, it's a potential life. Really? So if it's a potential life, please tell me what it is now, right? It's a potential human. Really? That's interesting. What is it now? Is it a giraffe? No. Is it a generic? Is there a generic life? Oh, wait, we're not even sure if it's a life, right? It's a potential person. That's interesting too. What is it now, right? Now, biology took care of the first two. If somebody says, I'm not smart enough to know when life begins, that's fine. You say you're not smart enough, go talk to a high school biology teacher. They'll explain it to you. All right. As soon as you have new gametic material and you have, the cells coming together, it's life. If it's not life, what else is it? And if it's not a human life, I'm sorry. Do we have is this extraterrestrial? Is there something else going on? Personhood is a philosophical and theological argument. Okay. What we will say is we can't imagine a human life that's not a person. Now, if you're going to put this into rationality, let's go back and talk about Descartes and Hobbes and those guys. That's why they set the stage for a lot of this. All right. Now, that's not the argument I was telling you about. Little Aristotle. Potency is not. Well, let's just leave it simple. It's the potentiality within a thing. Okay. It's its future. There is no other future except this potentiality. The act is, it's the perfection of it. It's what it is now, right? So in Thomistic metaphysics, God is pure act. There's no potentiality in God, okay? It doesn't take much just to say that. So and this is an argument that I came up with, but I found it elsewhere. This isn't like it's brain science. This stuff it's pretty simple. An acorn, if we have to say what is the potency and what is the actuality of an acorn, right? Well, its actuality is the perfection of it. It's an acorn. That is what it is. What is it potential? Okay? It's not a potential life. It's already something. See, everything in morality is based on being. What is it? If you can't say what it is, like if somebody says, well, we don't know if it's a life. Okay, that's fine. I don't know why you don't know that, but at least you're being honest. So let me ask you a question. We're going to, implode that building over there as we're putting in a new stadium. We're not sure if there's any people living in it. Should we implode it? Or should we verify if there's somebody in it or not? It's not that hard of a concept to understand. If we don't know, I don't know how you don't know, but if you don't know, then the only proper action is none. That should be simple enough. Okay, so it's a potential sapling. When it is a sapling, right, the little tree, that's its actuality. It still has potential. It's future. It only has one future. This is never going to become peanut butter, right? So when people say, the child's a possible human person, what do you mean possible? It's its only future. There's nothing else it can be. Well, yeah, but it doesn't always happen. Yes, that's true. And sometimes, saplings get knocked down with weed whackers. That doesn't change the fact that it still has the potency of a tree. All right? It still has the potency of a tree. So the actual tree then. So we'll do this with a human. It is an actual fetus. Its future, its only future, unless something goes awry, is to be a toddler. Or whatever you want to say, infant. The toddler does not, in some possibility to be this, its only future is to be an adult. There's no other future for that. Now, it doesn't take much to explain this, and you'd get good at it. At all of these stages, the essence is an oak. When it was an acorn, it was an oak. It wasn't going to become a maple. When it was a sapling, it was an oak. When it was the actual tree, it was an oak. Its essence, its nature never changed. It was always that. When we talk about an embryo, the fetus, the child, the teenager, the adult, its nature is human. That's all it ever was. Because it can never become something else. And this was not going to become a giraffe. So if somebody's going to say, it's a potential life, okay, that's almost retarded. It gets to a point where you almost have to call it out. Are you telling me that it's dividing cells and it's not living? How does that happen? Okay, so I grant it's alive. Okay, so you're going to say it's alive, fine. Now, what is it that it's living? Because there is no such thing as a generic life. We don't have generic lives to become whatever. So is this a giraffe? No. Is it a rhino? No. Is it a jellyfish? No. It's a human. All right, so we have decided through science that it's a human life. Now, you want to say we don't know if it's a person yet. Fine. That we can have arguments about. But I'd like to know why you have not already learned from history that when you start to attribute personhood to something other than every human life, that we have issues. That's a problem. So at some point, now, if you want to be reasonable, like Peter Singer from Princeton, that says it's self-awareness, all right? But when is self-awareness, does anybody when does it happen with a child? Like 5 months, 6 months, that they start to, hey, that's my hand, So Peter Singer is consistent. It's horrible in our mind, but he says up until they are self-aware, you could abort them, you could kill them, because they're not aware yet. Even like Hitchens and other atheists, they said, look, if you're going to call it an unborn child, the term child has to have meaning. So the fact that you say it becomes, like in the United States, when does it become a person? When it's out of the womb. Well, yes, when its head's out of the womb. Which is why partial birth abortions, and I don't want to disturb anybody if you don't know, but the child is turned in utero, so the head remains in, and then its skull is crushed before the head comes out. And that's legal because it's not yet a person according to the Constitution, which in this frozen embryo case that's going on now, boy, if they call those embryos persons, it's done. I mean, I don't think they will, because I think it'll be over. So that's the argument. But that's a terrible argument, and even atheists who aren't religious say that's a lousy argument to say just the fact that it's outside the womb, in, out, becomes a person. So what, if it can be out at 23 weeks, or it could actually be in for 42? Somehow that, not to be silly, but this isn't real estate, location, there has to be something more than that. And this is the reality of it. You can't get around calling it a human life. If you're not calling it a human life, you literally need to talk to a high school biology teacher. If you're going to call it not a person, then you've got to tell us what is your definition of a person. And you're probably going to make some argument from Descartes or Kant or one of those guys about rationality. And then what you're going to find is your definition of person doesn't only begin at self-consciousness or self-awareness, but it's also going to leave them in the latter part of their lives. Or it could leave you, I'm not trying to be silly, but there were even, there's people who argue that your consciousness leaves you when you sleep. I'm not saying anybody's saying you could kill somebody because they're sleeping, but I'm saying you start to get into an argument that gets very difficult to maintain, which is what Peter Singer did. Now again, he was firm that you do not take care of the elderly. Once you hit 75 or so, he did so with his mom. And everybody called him out for it. They called him a hypocrite because he went what we'd call proportionate care. And he just, in the end, admitted weakness and said, I was wrong, that I took care of my mother like that. It's heinous, but at least he's consistent. You can have a conversation with him. Yes?
This is an interesting discussion. And I think it's pretty solid, but I think when this is actually happening, I don't think people, like a woman in a crisis situation, I don't think she's going to think this way. It's tunnel vision, and people in a crisis, there is a tunnel vision. They only think it's one solution.
Absolutely.
And they're very focused on that, and they almost have blinders onto any of this stuff. This would be like noise to them. I don't want to hear it.
Well, it's emotivism, and this is why, in the end, the last class before the dialectic, we're going to talk about beauty saving the world, because you can't, a rational argument, you're not going to win somebody with a syllogism. I mean, I don't know where you go with this. Now, this particular guy that I was talking to, he's a doctor now. Everything with him is rational. He said, I don't see the argument against this. I said, I don't know what it is either. I said, it's not like we're that clever. We're just saying what it is, But you're right. A person that's in crisis is not going to work through this.
But I think it's very important that people know this.
Yes.
Actually, before they're in crisis.
Absolutely. That's a big
really,
part.
I think that's where the gist of this, and this is the benefit of it.
Which, you're seeing people rising against selective abortion because of ultrasounds and such. They try to make, I don't know if there was some lawsuit, they were trying to get like images of unborn children off of ads and such because it was affecting women. Once you see the child move, then all of a sudden, it's alive, it's a human, and all of a sudden you're like, this is mine, But just know that if a power has not been actualized, right? Like if I couldn't walk, I have a power that's not actualized. I don't cease to be human because of that power. If I lost sight or hearing, you name it. These are unactualized powers, or through some defect, you lost the power. It's technically there in potency, even if it may never be actualized. But when the power has been taken away, it remains proper to the thing's essence. All right, so the human, it doesn't matter what stage the human is at. It's all, these things are proper to their essence. Even if we say, my God, it's only 6 cells. Okay, but this is its essence. And all these things are proper to the essence. They have not been actualized yet. Given life's natural, progression, this is its only future. There is no other future, But to be honest, if you can get somebody to at least the life and the human aspect and leave the personhood, at that point, you have them from birth to, 5 months old. You have that window where they're going to have to either find themselves inconsistent, because they're going to know that just saying the child's born at this time isn't a very good indicator of when personhood begins, even if it's a legal one. We're not here to argue legal. You're going to have to make a decision that it was always there, or that it occurs, at self-awareness. And if you say it's going to curb a self-awareness, then you have to be an advocate for infanticide. Or not an advocate, but you at least have to be a defender. And if they are comfortable saying that, you at least have a rational person in front of you. You know, you could at least argue that. You know, but you know, good luck with how many of those, right? Anyway. Okay. Since, you know, we'll finish with this, mental health. So American Psychiatric Association, 1 in 5 have some mental illness. You know, I don't think that they qualified, at least I couldn't find in the study what exactly that was. I know with the I can't talk, the DSM-5 says, but so 1 in 24 have a serious illness, 1 in 12 a substance use disorder. So they'll say mental illness refers collectively to all diagnosable mental disorders. There's some significant change in thinking, emotion, behavior, distress, problems, functioning, and such. Faulty use of, and this is Benedict Ashley, faulty use of development of the sensitive and affective capacities. So there's some impairment, some faulty development of function that inhibits the capacity of the person. Either they are not able to adapt to whatever's going on, there's some development cause there, and this then compromises their mental health. And it goes without saying how this is a huge issue in our country, and people care little for it. It doesn't matter how much they say. When you're paying, like my wife worked with development disabled people, you know, master's degree, and you're making $9.50 an hour, you can call it important all you want. That's the reality of it. Because they're working off of grants. She worked for a head, handicrafters and such. Anyway. This is almost, you know, he had quite a bit on this. So if you're ever interested, and I can give you the sources on it, most of this stuff, we would say it's common sense. At least I think we would, right? Of course, it's happened over the course of the years where things that were, you know, they've done intentional harm to mental patients. You know, we've come so far in the last 100 years. If you were diagnosed with schizophrenia in 1950, you might have just had depression. I mean, that was such a broad category and such. So things doing without their consent, discontinue, personally, social, you name it. We can't do anything that destroys the person's freedom. They have to participate in their care to the best that they possibly can. They have to be informed the best they possibly can. Of course, you can do things against their will if it was for their best. You know, my wife, when she came out of college with her psych degree, she went right to a women's prison. And it was the best thing for her because she just thought, I think I shared with you, she thought every single person could be absolutely healed 100% and realized, you know, the reticency and the problem. And this is before Muncie was even had gates and everything. People would walk around. She had too many experiences of group therapy where people would come in group therapy simply to get out of solitary confinement, because in solitary confinement you're allowed 2 cigarettes a day. You could have 1 every hour if you were in the MHU unit. But she said they would struggle because these people were not well. They would swallow staples. They would break fluorescent tubes trying to chew on those. It was ridiculous. And you know, she didn't lose her zeal or her shine, but she realized how much of this is maintenance. And not in a bad way, how you have to keep people from harm. And then she also thought, even like Move from Philly area was up there, and she had said, she goes, I listen to some of these stories. And she goes, I keep thinking if that were me, I'd probably be in here myself. You know, that type of thing. And she knew the right thing to say, like even for a job interview. You know, now you're not the kind of person to bring stuff home. You can leave the stuff at work, right? Yes. Really? Does anybody do that? It's impossible, right? It's impossible, but it affected her, but in a good way. This last point, you know, you can read it and somebody's going to email me and say, what's that? You know, this comes from Ashley, so I'm not making it up, but can you use some of this stuff for relaxation and pleasure? Is it in itself ethically wrong? You know, they say probably not. I mean, there's other things to be concerned with. You know, where does that fall with use of tobacco, marijuana and such? I don't know. I'm not an advocate for that, but I've also been in discussions with priests and also with other bioethicists, and I said, I know it's illegal. If it were legal, what would be the moral case against it? And I haven't heard a good case. A nurse was really getting on me, a school nurse, and said, hey, look, it's a drug, and alcohol's a drug. And I said, okay. I said, I don't do marijuana. I said, but I do drink alcohol. Am I a druggie? She goes, no. I said, well, nicotine's a drug. I said, let's define what a drug is. Some of this is difficult, you know, and I'm not here to solve anybody's issues. This is where I think caseworkers have to deal with, you know, right on the actual case, to be redundant. And these things, I'm not going to reiterate on them, but we're always worried about transference, violation of trust. And even, you know, in the sense of the therapist having, you know, I'm not saying that they're not pleased with what they're doing, but, you know, this is part of a problem. Could they then this is where they feed off of these people's problems and such. You know, my daughter, I'll talk about her, she's, you know, this girl, she had 2 friends that committed suicide, another one whose mother killed her and then killed herself. What are you know, 9th grade, you're dealing with this kind of stuff? And she wanted to go into psychiatry and such. And even when I would take her out for lunch, like in 9th and 10th grade, it was interesting. We'd go out for lunch and she'd ask me a question and go like this. All her friends came to her because she was like adult in the way her thinking. And I had to like lay the law down. You're not a therapist. You have no capabilities of handling those issues. I am not dealing with those issues. And you're a 9th grader, you're not dealing with it. Because, you know, in other words, you know, could this be that you're getting gratification out of, I feel like I can help here? I don't know. You know, all these are, you know, he lists them, is why I put them there. But they're all pretty much straightforward. We're going to talk about this in the last segment of the class. This is a great book, The Triumph of the Therapeutic, by Philip Wright. Does the therapeutic system have a built-in set of values or ideologies that it inculcates? I just read an article today, maybe I'll put it up too. We were talking about it before class. I was with somebody that Zoloft, which was supposed to be a drug designed to help somebody over hard times, 2 months, 3 months, people on it 2 or 3 years, they're finding out that there's a fair number of people that are having withdrawal issues. They can't get off it. They're not having issues. They can't get off it because they're still depressed. They can't get off it because of dependency on the Zoloft. And the doctor who wrote this, or at least was interviewed in this article, said, you know, we weren't prepared for this. You know, in other words, if you know how some of this, and I'm not a psychiatrist.
Like a psychological dependency, or?
Well, no, they're having physical issues, physical withdrawal issues. But you know, if you look at the criteria for clinical depression, and the way it's laid out is that if you have 5 of those for 2 weeks, you can be declared, you know, depressed, clinically depressed, and then put on some sort of medication. You know, I'm not trying to say that any of that should stop. What I'm trying to say is that there's a lot of even therapists that I know and talk to about it that say, you know, we have gotten to the point where we think, you know, the therapeutic person thinks that we should always be happy. We no longer know how to deal with normal sorrow. You know, there are times where, yes, a person is clinically depressed, and there are times where you're like, I have relatives who, you know, the woman lost her son in a very unexpected accident. He was an epileptic that died in the shower, and now she's estranged from the family and her grandchildren. Never to see them again. Okay, if she's struggling with this for a year, would you expect anything different? You know, now, okay, I'm not saying that maybe there are medications that can help over the bridge, but what they're finding is that, you know, I think this paper said that the number of people on antidepressants has doubled in like the last 15 years or so. I mean, we're not that bad. I mean, there's something going on there. And the doctor was writing and said, we're not prepared for this. You know, and I think he, you know, he didn't say it, but their hands are tied too. Do you want to be the physician that doesn't give this? You know, I wouldn't want to be. It's a difficult case.
I think part of the problem is that who's prescribing it. So if you broke your arm or something like that, you wouldn't go to your general practitioner, you would go to an orthopedic.
Absolutely.
So if you have a mental health issue.
Should the GPs be doing this?
And they're the ones that are prescribing it most of the time.
Well, my personal opinion is they shouldn't, but
Yeah.
that's not, I don't think that'll change. But, so anyway, but he makes the case, you know, and we're going to tie this into religion in the end. We'll call it therapeutic deism, you know, because they've taken this idea and they've put it into religion. But it's built on, you know, in other words, are the people, I know this sounds conspiratorial, but he makes a good case. Are the people who are pushing this idea, is that an ideology? What's it based on that they're trying to say that this is the type of life and feelings that we should have towards each other? It's interesting, I was just reading this Jewish blog about suffering. What a different understanding of suffering that the Jewish people, even today, have in suffering. And I would love to see if there's any statistics on if they have lower use of antidepressants. I don't know that. But I was looking for the quote that this rabbi had said, and I can't find it. A person who has never suffered, what do they know? In other words, you don't know anything, you know? So, you know, but we don't live in a world yet, you know? Okay, so, you know, my father was born in the 20s. There was 14 in his family. Most of them, you know, you slept how many to a bed? You quit school early to go fight the war. You come back, you know, you didn't talk about any of this stuff. I started to think of their life. What were their expectations? You know, and compared to what my expectations in life were. Well, if my expectations are not reasonable, and I'm not activating those, will I sooner look for some sort of resolution here? You know, it's just things to think about. I'm not trying to declare anything. These are just things to think about. So we ask what, you know, and Rife says, what will this therapeutic man, what is a typical understanding of this? Do we need constant succession of intensely satisfying experiences? If we're not experiencing these succession of satisfying experiences, is there something wrong with our life? You know, are we not, you know, we might say I'm in a down part, but compared to who? You know, you might be out of work, you might be on unemployment, you're eating well, you're still doing a lot better than, you know, 2/3 of the world. I mean, I'm not saying that should not be a crisis in our life, but here's the other thing, and I wrote a paper on this, and the paper I wrote, I didn't get published, but it was called, I Feel Bad for You. And what I meant was, I'm feeling bad as a signal for you. In other words, this is my relationality. Do you not see the signifiers in me? You know, in other words, it may be we have lost this interconnect, and this is just me talking, this isn't the church, maybe we've lost this interconnectivity in our familial connections, and we're trying to adapt through medicinal ways, where in other situations, we would be there for each other. And even if it did last 1 year, 2 years of sadness, we're there for each other. You know, so I made the case of that, and I did it, you know, through using studies and such. But anyway, the psychotherapist, the grade that liked it. But nonetheless, and you know, in psychotherapy, you know, they're a little more leery against some of this. They would like to see, you know, more interaction. But you know, on the other hand, you know, if a person's in a suicidal state, this isn't the time to do anything but known ways. So, you know, if, like, I know a particular situation where the person was struggling with suicide for some time, seeking, you know, from a licensed, you know, PhD psychiatrist, and at one point when it was determined that it was hormonal, you know, and it went on contraception, even though it wasn't contraception, we know that now, well, you don't even think twice. This person is dealing with something that's right in front of them where their life, you know, they've already tried to attempt their life once. Well, you do whatever you need to do. So I'm not trying to say that, you know, let's not mix these things up. Again, I think the GP is not the one to do this, especially in today's Affordable Care Act when you have 15 minutes. And, you know, and you're not going to solve the issue then, but nonetheless. So anyway, the goals of therapy, whatever that therapy might be, they have to be related to higher social and spiritual goals. So yes, you can go to a secular therapist, but you better be getting some spirituality on the side, okay? Clients should not trust a therapist as omnipotent parents. Recognize they have limited skills, and they themselves, I mean, if anybody here ever watches The Sopranos, right, I mean, even the therapists are going to therapy. I mean, everybody's looking for this type of thing. When the client is sufficiently free emotionally, you know, in other words, get them over what's critical at that point, and seek guidance at the ethical and spiritual levels. Because sometimes these things are spiritual issues, you know, especially stress-related things. Sometimes, it's funny, I see that a lot of industries are trying to bring in philosophers now. I guess that's their secular religion. You know, they can't find meaning in life, so they'll bring in secular philosophy gurus that explain things to them. You know, why is my life to have meaning? So nonetheless, but that's it. Anything to add to this? Again, I wasn't trying to lay anything out. Benedict Ashley does a nice job of going over the whole thing. I just threw Philip Reif in there, or Reif, however you pronounce it, I'm not German. Just because I think overall we have a real misunderstanding of what happiness is. And, you know, especially in Facebook's this, I think, one of the biggest problems. Because you get tired of seeing people go to constant vacations, you know, every other week they're somewhere else.
Nobody posts about a picture of themselves. No. That life is always good, or you don't post it.
Yeah, and